the sports trainer. I just saw you fall. Are you okay?
No, I just tried to kick the ball and it hurts really bad. It feels like my knee just gave out.
Oh, really? What part of your knee hurts?
It just hurts all in here and I can't seem to move it or twist it.
All right, let's take you back to my office and we can get you checked out, all right?
Okay.
All right, well, by the looks of this, it's really swollen and you can't move it, so we should probably get you to the hospital and to a doctor to get more results, all right? All right.
Well, my knee hurts really badly and every time I try to move it or twist it, it just is an excruciating pain.
What were you doing at the time?
I was playing soccer and I just kicked the ball and it just hurt. And I fell to the ground and I couldn't move.
How did you fall?
I twisted it, sort of. It was just a sudden stop and then like a twist and it just hurt really bad and I just fell to the ground.
Okay. Have you been able to walk on it at all, or?
Not since then. It's
Okay.
been really hard to walk.
All right. We will need to take some x-rays. From the way you're describing it, it sounds like it's going to have been an injury to your ACL.
When looking at what an ACL injury is, it is important to first look at the anatomy of the knee. There are 4 main ligaments which prevent either front and back motion or side-to-side motion. The 2 that prevent the side-to-side motion are the medial and lateral collateral ligaments. Connecting the femur and tibia are the cruciate ligaments, anterior and posterior, which form an X connecting these 2 bones. The major causes of ACL injuries include a fast change of direction, sudden stopping, landing of jumps incorrectly, and collisions with a great amount of force. However, 70% of ACL tears are caused by the changes in direction and sudden stopping. Collisions only account for approximately 30% of ACL injuries.
Symptoms of ACL injuries are loss of range of motion, tenderness at joint line, discomfort while walking, and pain and swelling.
Injuries to the anterior cruciate ligament can be classified into 3 categories based on the amount of damage to the ligament. These grades range from mild to severe. The first classification is a grade 1 sprain. In this category, the ACL has only been mildly stretched and not torn. This is often remedied with the use of physical therapy or bracing. The joint itself is still pretty stable in a grade 1 sprain. The next classification is a grade 2 sprain. In this category, the ACL has been stretched even further than in a grade 1 and is possibly partially torn. This means that the ligament has not completely torn in half and severed from one another. This is the least common of all the classifications. Finally, there are grade 3 sprains, which are often just called complete tears. The joint loses essentially all of its stability as the ligament has completely torn in half. Surgery would be required to repair the torn ligament.
Alright, so I have your MRI results. Unfortunately, as you can see here, you did completely tear your ACL. As a result, like we talked about, you will have to get surgery.
The reconstruction of the anterior cruciate ligament can be completed by using the hamstring tendon, parts of the patellar tendon, or an allograft from a cadaver. The doctor would drill a hole into the femur and into the tibia bone, in which time they would pull this new tendon through those holes and secure it with screws. Post-surgery, one would need to complete physical therapy as well as have their knee braced. They would start by gaining back range of motion in physical therapy and work towards going back into their sports. Rehabilitation can take 6 to 9 months post-surgery. Physical therapy will focus on re-strengthening the quad muscles as well as improving range of motion at the knee joint. On successful completion of rehabilitation, athletes should be able to get back to their everyday lives.